to the Ontario Pharmacists Association news channel. Now we're going to look at three hot topics most popularly discussed. The first one being pharmacist roles from yesterday, today to tomorrow. Second one being some of the roles of pharmacists in Ontario. And the third one looking at students' perspectives regarding their advocacy association, such as OPA, Ontario Pharmacists Association, and CPHA, Canadian Pharmacists Association. So now first, we're going to look at a few short clips on the changing roles of pharmacists.
Oh, hi there.
Do you have my cough medicine ready?
Oh, yes, I do. Here you are. Just take this twice a day with water.
Oh, thank you very much.
No problem. Have a good day. Hi there, Mr. Warren. How are you doing today?
You know, I'm doing all right. Yeah.
Okay. What brings you to the pharmacy today?
Well, I'm just here for my meds check appointment, right?
Oh, all right. That's right. You are absolutely correct. You actually do have a new medication that your doctor called in today.
That's true. He did mention that.
Yeah. So this medication is tetracycline, and just be sure to take it twice a day.
Okay.
Be careful with milk if you do like to drink milk in the mornings, because it might cause stomach upset if you take it with milk.
Oh, okay.
All right. So here's your medication. I also wanted to ask about your diabetes.
It's doing all right. Sometimes I have a bit low blood sugars in the morning, though.
Okay. Do you have it any time, other time of the day?
No, it's just in the mornings generally. I mean, once I have some food, it's all right.
All right, that's good. So what kind of foods do you eat normally?
Well, sometimes I skip some breakfast in the morning, but I usually have something light, like a couple pieces of toast.
Okay, I actually do recommend you not skip any of your meals. It does help with the low blood pressure when you do experience it at times.
But it's busy.
Yeah, I understand. So, Mr. Wong, have you had your flu vaccine yet?
Not yet. I was waiting to make an appointment with my doctor about that.
Okay, well, actually, the pharmacy, we can do it here as well.
Oh, yeah?
Yeah.
Is that a new thing?
Yeah, that is actually a new thing, and we can give it to you right now.
Oh, really? Great.
If it's a good time for you.
Yeah, absolutely. I'd
All
love to
right.
get one.
Would you please just come with me?
Sure.
Hi there, Mr. Wong. How are you doing today?
I'm doing terrible. I've got these awful allergies. Ugh.
Wow, that sounds terrible. What kind of symptoms do you have?
Oh, it's just my nose is all congested. It's like I've got all this mucus and like all this nose blowing has made my nose so red and irritated.
It sounds like you have inflammation in your nose. What I can do for you is I can prescribe Neris, and that's going to take away the inflammation and make you feel better.
And it works better than that over-the-counter stuff?
Yeah, it actually does. This is actually a prescription medication.
Okay.
And
Great.
what you do is you can take this once or twice a day, and whenever you need it. Does that sound good?
Yeah, fantastic.
Okay. Now with your condition, smoking may worsen your symptoms, and you did mention last time that you were smoking. So, have you given it some thought about quitting at all?
Well, you know what? These allergies are just killing me. So, you know what? Let's go ahead. I always thought about quitting. Now's a great time.
Okay. Well, the first step to quitting is I can prescribe you a medication called Champix.
Oh yeah.
And with this medication, you just take it once a day for 3 days and twice a day thereafter.
Yeah, and it'll help with the cravings, right?
Yeah, of course. And that way you can control your smoking and your symptoms.
Oh, fantastic.
Yeah.
This sounds
All right.
great.
I'll see you next time then.
All right, thanks.
All right.
Watching the short clips, hopefully we now all have a better understanding of pharmacists' roles in the past, present, and future. So evidently in the past, pharmacists have been focusing mainly on dispensing and compounding medications with minimal patient interaction. Pharmacists have expanded their scope of practice to include med checks, which involves checking medication therapies, correct wrong dosages, and noticing significant side effects associated with these medications. Then there's also counseling involved, which involves either acute or chronic illnesses, and also incorporating non-pharmacological treatment plans in the process. Then finally, there is the ability of pharmacists to provide injections, so that now the general public can go to their local pharmacies for their flu shots. And now looking into the future, hopefully pharmacists will be able to prescribe certain medications for various illnesses like minor ailments or long-term treatment plans like smoking cessations. to be able to perform subdermal procedures like glucose testing for education and demonstrating purposes, to be able to order lab tests for further diagnosis, and also extending chronic medications. Now for our second hot topic, we have interviewed an expert in the field for her opinion on the responsibilities and roles of pharmacists in Ontario. Now let's take a look at another short clip. Hello, my name is Dr. Wang, and I'm very excited about the pharmacy profession in Ontario. I believe we need to focus on three main points. The first one being patient-centered care. By patient-centered care, I'm talking about having a whole healthcare team revolving around the patients and providing care, so that the patient can have the ultimate autonomy and decision-making in their treatment plans. Also, follow-ups are extremely important because this ensures a continuity of care for our patients. Secondly, the interprofessional healthcare practice has becoming more and more popular, and as pharmacists, we need to integrate ourselves into a healthcare team and work together with doctors, nurses, physiotherapists, and social workers, to just name a few, and together formulate the best possible treatment plan for our patients. Pharmacists in long-term care centers, hospitals, and family health teams should definitely be most aware of this, and we should not only be an additional line of defense in terms of treatments, but also take initiatives and leadership roles in this interprofessional practice. And last but not least, I think we need to focus on ourselves as a regulated professional body. We need to raise awareness in the general public, in the students and the professionals themselves, and also with the government to fight and protect our rights and also ensure the prosperity of this profession. Was definitely an interesting take on the roles of pharmacists in Ontario by Dr. Wang. Now, many would also be curious for our students' perspective on the roles and responsibilities of their advocacy association. Why don't we take a look?
So I was really excited to hear about the expanded roles of the pharmacists. I mean, who isn't excited about being able to give flu shots and all that fun stuff? So I think it is very important for organizations like OPA and CPHA to be there for us so that they can help us grow in the healthcare professions and we can help out more. So that's really cool.
So one of the beneficial things that I think would help a lot of students, especially when they're finishing, that I saw happen this year, I'm not sure if it happens every year, but shoppers came by and they did interviews for the whole grade for possible job interviews, which I find would be beneficial, especially for the newer people who haven't had jobs before, to help break them into the hiring process and the interviewing process, which they may be more unfamiliar with or just unsure with. It might help them a lot, especially when they're starting off after we graduate. So in our fourth year, it'd be good for some people to come by from different companies and possibly give us interviews.
Responsibility should be advocating for the profession and increasing public awareness about recent expanded scopes of practice.
I think it's really important for people to know that pharmacists do a lot more than just give drugs out. I think it's important to talk about how we help patients, for example, how we educate them and how we help them with their medications.
I guess it'd be beneficial for pharmacists and pharmacy students for them to advocate as in terms of the scope of practice of pharmacists and the recently expanded scope of practice, because a lot of people are still unfamiliar with what kind of cognitive services and other services that pharmacists can actually offer. So I feel like pharmacists are still kind of underappreciated, and many people are not aware of what they can do for their patients. So I feel like it'd be beneficial to just spread the word as to what the new scope of practice is for pharmacists and possible future expanded scope of practice as well.
The role of an advocacy organization, in my opinion, should help promote the implementation of the roles of the expanded scope. For example, they could provide more education or provide more training for the pharmacists so they will be more comfortable with implementing the expanded scope into practice.
So OPA, they've been advocating for expanded scope of practice. So pharmacists are the most easily accessible healthcare providers in the community. And so now they can do things like smoking cessation and flu shots and diabetes education. And I feel like advocating for further expanded scope is just going to increase, the pharmacist impact they can have on the community and help relieve burden in clinics, as far as wait times and, free up doctors to do other things. And then also, we can relieve the stress of patients because they'll have easier access to certain things.
I guess adding on to that, part of it would be because they're representing our best interest at a level, they should be representing the patient's best interest. So an advocacy group shouldn't be, trying to advocate for a cause that would, let's say, be a huge burden on the patient. And I guess OPA has a lot of work ahead of it as well, considering how Ontario, like pharmacists in Ontario, we've got a ways to go before we catch up to some of the roles that pharmacists in other provinces have gained. So it's certainly got their work cut out for them.
Yeah, and certain things that also OPA membership has a lot of advantages. So I know I take advantage of insurance and the Good Life membership. So continuing to offer certain benefits through the membership, and that's always a plus.
And the annual conference is always pretty good too. It's pretty educational, I'd say, and it pretty much reinforces how far we've come since, let's say 20 years ago when all we did was basically lick, stick, and stamp.
Yeah. Also, OPA, I know they offer continuing education for pharmacists and pharmacy technicians. I feel like these are really important because, the face of medicine and healthcare is always changing, so it's important that pharmacists, once they graduate from school, to stay updated and stay educated on current topics and new practices in medicine.
Yeah.
All for today's OPA news session. Until next time.
I don't know.
I don't even know what that is. So
Yeah, it's like the student advocacy group. So